Well, good morning and welcome to the second session. We're glad that you all are able to make it today, and I want to introduce to you our speaker for this session. It's Dr. Schmid. He is a foot and ankle surgeon practicing in Cuyuna Regional Medical Center in Crosby. He's a graduate from the Dr. William Scholl College of Podiatric Medicine. It's good that he can pronounce the word right. And completed a podiatric medicine and surgery residency at Detroit Medical Center in Detroit. Dr. Schmid is double board certified by the American Board of Podiatric Medicine and the American Board of Foot and Ankle Surgery in foot and reconstructive rear foot and ankle surgery. He's deeply involved in his profession, having served on the board of Minnesota Podiatric Medical Association for the past 12 years, including it as its president, and contributing to the American Podiatric Medical Association through service on multiple committees and its board of trustees. In addition, Dr. Schmid has participated in the MOLO medical mission for the past 5 years, providing essential foot and ankle medical and surgical care for the community of Molo, Kenya. Dr. Schmid also maintains a personal connection to the Cross Lake area, where he spent many summers growing up and has proudly completed the Doozy Challenge several times at the place formerly known as Crafts and Cones. So let's welcome Dr. Schmid.
Thank you, appreciate it. All right. Hi, everybody. Good to see you here today. So, like he said, I'm Dr. Schmid. I practice at CRMC, and I came back to the area about 2 years ago, and it's been a great transition for both myself and my family, and I have a deep connection to the area. So I'm very happy to be here today to speak with you. So we're going to talk today about foot and ankle arthritis, and it's a very common thing that we see in our practice. What is arthritis? Some of you probably already know what it feels like, but basically it's a degeneration of the joints. It's very common in the foot and ankle. We're going to talk about the symptoms of it, how we diagnose it, as well as our non-surgical and our surgical treatment options, because there are both. So arthritis is really joint inflammation. It's a breakdown of the cartilage. And usually what you're going to experience is pain, stiffness, and maybe swelling or maybe a deformity of the joint. When you think of the foot and ankle, people are surprised to hear this, but 1/3 of all the bones in your body are in your foot or ankle. So we have 28 bones, we have 29 plus joints. Some of the key joints that we talk about, in this talk would be the ankle joint, what's called the subtalar joint, which is just underneath the ankle joint, midfoot, which is a series of a bunch of different joints, and then the great toe joint. Those are kind of the more common areas we see arthritis in the foot and ankle. So there are a lot of different types of arthritis. Some of the more common ones, we have osteoarthritis, and this is what we call primary arthritis of that ankle. You can see there's not much gapping between the ankle. It's kind of tilting in the ankle joint. We have post-traumatic arthritis. So if you've previously injured a joint, or in this case, someone had a broken ankle that was fixed, but later on ended up getting arthritis because of that. Then we have other types of arthritis. There's rheumatoid arthritis, there's psoriatic arthritis. There's a lot of different types that can come into play, and they're more of a systemic condition. And then gout is another type of arthritis as well, and it can have long-term manifestations. So what are you going to experience when you have arthritis? Pain with activity, some stiffness of the joint, some swelling, maybe difficulty walking. You might notice that when you first get up in the morning, that first couple steps, you're like, oh, this is this achy or painful. Maybe it loosens up a little bit, but then as the day goes on, you're going to notice more pain. That joint's going to become inflamed. It's going to become more painful to move. How do we diagnose it? Well, a physical exam is obviously a big part of it. We want to know, what you're feeling, what you're experiencing. We're going to take x-rays of the foot or the ankle to take a look at that joint. But there are some joints in the foot that don't show up all that well on x-ray because, like I said, there are a lot of different bones. There's overlap between some of those bones. And so in some cases, we might opt to get a CT scan, which is really good to show the joints and the bones in the foot. So we have a lot of different treatment options, a lot of non-surgical treatment options. Typically, at first visit with one of us, we're going to talk about if you're doing some of these, and if not, we're going to educate you on that. And so activity modification. So if there are certain activities that are causing some of your pain, you might have to modify that. A great example is, I have a lot of patients that do yoga, and there are certain poses that cause them pain. Otherwise, they're doing pretty well throughout the day, and so we talk about how you can modify your poses to prevent yourself from having pain in those joints. I might recommend icing and heat. Typically, I recommend heat first thing in the morning when you kind of get up and feel that stiffness, kind of loosens things up. But later in the day when that joint is painful and inflamed, you don't want to add heat to it because it's going to cause more inflammation and more pain. So at that point, you want to put ice on it. We have non-steroidal anti-inflammatory drugs, or NSAIDs for short. They're kind of a first-line treatment for arthritis-type pain. It targets inflammatory type pain, which is what arthritis is. We have different bracing options and orthotics. So the two pictures on the top are what are called custom orthotics. So it's a custom-made shoe insert made to your foot. And the way we use that is we use it to help brace the foot, essentially, prevent certain abnormal motions or correct the positioning of the foot, because a lot of times with arthritis, it happens because it's a mechanical issue. The position of the foot is not correct. Maybe you're flattening down over time, and so this will help correct some of that. And on the bottom are two braces. They're called ankle foot orthoses, or AFOs, and those are used a little bit more for more advanced issues or advanced ankle arthritis that we don't have any other treatment options for. But they can be very helpful in a lot of these situations. Physical therapy is also a great option for us. There are a lot of things that our physical therapist colleagues can do to help with managing some of your arthritis type pain. We do have injections which can be helpful. They typically are steroid injections. And I tell my patients, it's a Band-Aid treatment, not going to fix your problem, but it's going to help with your pain. And so steroid is a very powerful anti-inflammatory medication. We're putting that right into the affected joint so it can reduce the inflammation and the pain in that joint. And I have some patients, I'll get a year plus relief out of that. Some it's 6 months, 3 months, 1 month. So it does vary from person to person. And what we do find is repeated steroid injections over time, the effectiveness does go down. So you might have a year plus relief, and then after a while, maybe you're noticing it's 6 months or 3 months. And so it's a good short-term option, but usually we're doing it in conjunction with some other treatments for this. And then we have different shoe modifications. This is just an example of a tennis shoe here. A lot of people have arthritis in the middle of their foot, that bump right on the top of the middle of the foot, and that's painful, especially when the shoe is pushing down on that spot. And so you can kind of see here, we relaced that shoe to help alleviate pressure in that spot. So you're kind of unlacing the shoes, and you're going to skip that crossover section there so that it's not pushing pressure down right where that bump is at. And that could be very effective for that midfoot type arthritis. So when should you consider surgery for something like this? A vast majority of our patients with arthritis don't need surgery, okay? We have a lot of good conservative treatment options, but there are times where they have persistent pain. We've tried all the conservative options and they're really not helping. And it's causing a limited function. And I always talk to my patients about this, and I say, if it is preventing you from doing activities that you normally want to do, and we've done all the conservative care, then surgery might be a good option for you. So there are a couple different surgical options. We'll go into a couple of these in a little bit more detail here. But it can range anything from removing a spur to doing a joint replacement, depending on the joint. So a debridement, or what's called a cheilectomy, is something we sometimes use. In this picture I have of a great toe joint. You're basically going in there and just resecting the spurs on the top of that joint. And that can sometimes be helpful. It's more of a short-term issue. A lot of times big toe arthritis is a mechanical problem, and if you don't address the mechanics behind it, that spur is going to come back, or the arthritis is going to progress. But for some people, this can be a good option. Really quick recovery, you're basically just waiting for the incision to heal, and at that point you're back to going about what you were doing before. There are types of surgeries that we do, or they're called fusions, or what's called arthrodesis. And so what we do is we actually go in and we remove the cartilage and remove a little bit of bone on either side. And we put plate and screws across here to kind of stabilize it and allow that healthy bone that's touching healthy bone to kind of fuse together so you no longer have a joint. And we do this on some occasions. There are some joints where we don't have other joint replacement options, and a fusion might be a good option for some people. It does eliminate some of that. It eliminates the motion of the joint, but a lot of times when you have an arthritic joint, you have very limited motion in that joint to begin with. It's a reliable pain relief option for us. It's durable. It's going to hold up long term. The trade-off is that you do lose that motion of that joint, and what it does is it puts a little bit of stress on the joints above and below that, and it, in some cases, depending on the joint that's fused, may alter how you walk. A vast majority of the joints that we do will not alter how you walk, and even an ankle fusion, if we have to do it, doesn't necessarily alter your gait, but it can. In some cases, we might do more like a structural realignment. So if it's a a positioning issue that's causing your arthritis, there are different types of procedures we can do to help alleviate or help improve the positioning issue to prevent that arthritis from progressing. And there are cases where we'll do that, and it's very helpful. Arthroplasty or joint replacement is a common one that we use. The great toe joint we have a replacement option for, and the ankle joint we have a replacement. Show of hands, how many of you are familiar that ankle joint replacement is actually a thing that we do? We hear about knee and hip all the time, but ankle is not maybe one that you're familiar with. So we have ankle replacement as an option. I'll go into that in just a moment. And the implants that we have now are really on par with the knee and hip implants, and they do last quite a while, and they do very well. But the advantage of doing like a joint replacement is that you are preserving the motion of that joint. It's reliable for pain relief. It does a pretty good job long term. It puts less stress on your other joints that, like, for example, a fusion might do. And it allows for more natural walking. The trade-off is that some of these joints have a limited lifespan. I always tell people about 25-ish years, and at that point, if you're 80, you don't really care as much. But if you're on our younger end of the spectrum, that might be something to consider. And there are reasons why we might not do a joint replacement on people depending on their health or what we call other comorbidities. But whenever we can, we try to do this. So here's an example of a great toe arthritis. You can see here that there's really no cartilage left in that joint. And on an x-ray here, when you're looking at a joint, you should see bone, and a nice dark even gap is where the cartilage is at. Cartilage does not show up on x-ray. In this case, that big toe joint's very arthritic. There's no cartilage left, big spur on the top. So there are different options depending on how advanced this is. So for example, we can do a joint replacement, which I showed you in the previous slide. We can do a joint fusion, which is also a very reliable way to treat this type of arthritis. And sometimes if it's a structural issue, we can do a structural realignment of that joint. So a lot of different options with this joint, just depending on how advanced it is and some of the other things that we're looking at here. Midfoot arthritis, I talked about this earlier. That's that kind of bump on the top of the foot there. Happens a lot of times when your arch starts to collapse down on you. And when you're walking, that repetitive collapse of the arch causes jamming at those joints, and it causes the cartilage to degrade and a spur to form on top. And so in these cases, a lot of times that shoe modification I showed you to, relacing the shoes can help. We'll do injections for this joint. And if those aren't working, a lot of times we'll do a custom orthotic is another option because it's going to help hold that arch up and prevent this from collapsing and jamming on you. But there are times where we end up doing surgery. In this case, usually it's a fusion procedure, but it's one where people do pretty well once that's fixed. And then you can kind of see that line is showing, kind of hard to tell, but that arch is kind of collapsed down, so it's almost like a negative arch at this point. And then ankle arthritis is kind of a big one. It's a part of our field that's advancing over time. You can see here, there's no gap between those bones there. That is bone-on-bone arthritis there, and it's very painful for some of these patients, or some of my patients. Some of the shoe recommendations I give for this, that one on the bottom is what's called a rocker bottom shoe. So it has a flare in the back and a flare in the front, and it allows people when you're walking to kind of more roll over it rather than pushing off with your ankle. Allows kind of more of a rolling motion. And the shoe on the top we'll sometimes use for ankle arthritis, or if we've done an ankle fusion, and that literally has a spring in the heel. So it's going to put a spring in your step. But and those can be helpful as well. And then for some people, if they have advanced arthritis and surgery is not an option, we can use an ankle foot orthosis to help kind of support and lock up that ankle joint. So here's an example of an ankle arthritis patient as well. That's a pretty bad looking ankle joint. And in this case, in one of these cases, we did an ankle fusion here, which alleviated their pain. But we also have the option of doing an ankle joint replacement now. Another example of an ankle replacement surgery. So this is a pretty bad looking ankle. It's bone on bone. That ankle is actually tilting in the ankle joint. And you can kind of see I kind of put a line on both of those to show that tilt in the joint. And then we did an ankle replacement surgery, and we were able to realign her joint, and she did very well. Another example, really bad ankle arthritis, bone on bone, tilting a little bit. We ended up doing what's called a stemmed implant. There are a couple different ankle joint replacement implants that we can use, and these ones tend to hold up pretty well long term. And so these are just some examples of patients we did ankle replacements on and did very well. And this field's advancing. There are more options that we can offer people. I ended up doing a surgery recently where I did an ankle joint replacement, and they were missing the fibula, or part of the fibula, which is the bone on the outside of their ankle. And I designed and we did a 3D printed fibula implant. So I actually replaced their fibula bone, which I think has only been done, to my knowledge, twice before in the country. So really kind of cutting edge stuff we're able to do with the technology now, especially with 3D printing, that the implant's made out of titanium, so it should hold up long term. So the recovery after this, usually depending on what it is, if it's a fusion, we typically have to keep you off your foot for roughly about 6 weeks. For example, our ankle joint replacement, it's 2 weeks of being off of your foot, and then we let you start putting weight on it, and we start that physical therapy process. Physical therapy is a great option after surgery, or even before surgery. There's a lot of things that our physical therapist colleagues can do for us. They might work on range of motion, strengthening, gait training, things like that. The picture on the right we have at CRMC, it's called the Alter-G treadmill. And it's a treadmill with basically you put on this kind of pair of shorts with a zipper in it, and you zip into the treadmill, and they're able to add air or pressure into the underneath you. So it can actually take up to 80% of your body weight off of your foot. And so it allows my patients to get on that treadmill and start walking early without putting full weight on their foot. The other really cool thing about this is it has a little camera that's pointing at your feet, so as you're walking, you can see how you're walking. And the physical therapist can say, okay, you're starting to veer off to the side, let's correct it this way. And so it can help alter your gait, and you get that feedback, and it's a really cool option. So I get really aggressive with our physical therapy after surgery, get them moving a lot earlier because we have this option. So key takeaways of this talk. So foot pain is not normal. If you're having pain in your feet, there is something going on. You shouldn't ignore it, especially long term. Arthritis is a common thing to see in the foot and ankle, and we do have a lot of non-surgical options, but when they fail, we do have other good surgical options. But the type of surgery that we recommend really just depends on what we're seeing, you as a person, everything, we take it in totality. We don't just say, this X-ray needs that patient needs this. So we do have a lot of options out there. So that's my talk. So I'm Dr. Schmid. I practice at CRMC. I'm in Crosby a couple days a week, and I have a clinic in Baxter. And my partner, Dr. Moore, likewise also practices in Crosby and does a clinic in Baxter as well. So if you have any questions, we'd love to see you. Otherwise, I'm going to be out at the booth here afterwards. So thank you.